Okay, good afternoon, everyone. In the interest of time, we're going to get started. It's noon right on the dot. My name is Kara Kumari. I'm Assistant Commissioner for Communications and External Affairs for the Department of Intellectual and Developmental Disabilities. While many people who are while many people are from DIDD, we've also invited our partners from DCS today to join this Lunch and Learn so they can learn more about Tier 2 on the HRA. Joining me today as a presenter is Bo Hickman. He's our Deputy Director of Intake and Case Management. He has years of experience in this role and also many years of experience. There are only 3 years of experience to be had in the HRA, but he has all of those years. So he'll be able to help answer a lot of questions when it comes to eligibility, as well as anything about PayFlex and how to get this process started. So with that, one thing that we do with our Lunch and Learns is I'll go through the presentation. And then, of course, after that, we'll open it up to answer questions. Just so you know, if you are an external partner, if you are not a DCS or DIDD employee, this meeting is actually intended for our employees. While there's nothing secret about it, we would like to keep it an internal meeting. So if we do see external guests on here, we are removing you just so that we can have this meeting to be with our employees only. So with that, I'm going to go ahead and get started. All right, please let me know if you can see my screen once I get it up. I'm going to make sure that it is in the slideshow. So are you seeing the correct process, the correct screen up? Bo, I think you're the only other presenter, so if you can let me know, that would be great.
Yeah, absolutely. Can see it, Kara. We're good to go.
Okay, great. So here we are today about Tennessee Strong Families, and more specifically, we are going to be talking about Tier 2 of the Tennessee Strong Families program, which is the HRA component. We'll go over a little bit of an overview of all 3 tiers and a little bit about Tennessee Strong Families, but then we're really going to do a deep dive into the HRA component of this program. So for Tennessee Strong Families, first thing is to know how it kind of came about. It was a part of Governor Lee's initiative, and as a part of that, DIDD is partnering with the Department of Children's Services to provide support to children in state custody who have intellectual and developmental disabilities. To that end, DIDD has developed what we're calling a tiered approach. It includes some immediate needs, fulfilling those immediate needs, fulfilling some needs that have been some long-term needs, and then some long-term planning needs as well. So this approach includes direct care services, so care that DIDD employees are providing directly to children in DCS custody, along with support for foster families. And then finally, in Tier 3, we'll be looking at home and community-based services for children with complex needs. So as I mentioned, this is broken up into 3 tiers. Tier 1 is that direct care component, and this is direct care for children who are in the state's children's hospitals that are awaiting foster placement. This is already happening. DIDD started supporting children in its state-operated homes in March. We have children in all 3 regions of the state, and we are able to support them in the homes that were currently being used as or formerly being used as intermediate care facilities for people with intellectual and developmental disabilities. Those homes were vacant. We were able to use those homes and train some amazing DIDD staff and be able to provide direct care for children who had been in hospitals awaiting foster placements and give them a more appropriate place to live and learn and thrive outside of the hospital while awaiting that long-term placement. Important to note that the Tier 1, those Tennessee Strong Family homes, are intended to be short-term placements until a foster placement or other long-term placement is identified. So Tier 2, which we're going to talk a lot more about, is really to address the needs that we had heard to help incentivize foster care for children with intellectual and developmental disabilities in state custody. It says targeting July 2023 implementation. We met that. This was implemented just last week. And now we have the Tier 2 Tennessee Strong Families HRA program up and running, and we're in the early stages of that implementation. Then we have tier 3, and this is our long-term approach. This is really where we're looking to develop additional capacity and support for those DCS custodial and at-risk youth. And we're looking really at those that have higher levels of medical and behavioral needs, and also addressing that need for therapeutic respite support. One thing we want to do is as these children are nearing the exit of that foster care system and the entry into the adult world, we want to make sure these children, the programming in this program in this tier will help meet those needs and get them ready for that independent life and adult life, and make sure that we're providing those types of supports that can help prepare them for entry into adulthood. So as I mentioned, this Lunch and Learn is primarily about Tier 2. This is the Tennessee Strong Families HRA program. And as I mentioned before, Tier 2 focuses on critical supports needed by foster and adoptive families to care for children with IDD. And really this came from a need to create stable placements for these children, especially those who have very high medical and or behavioral needs. One of the things that we really looked at here is to draw upon a model that was developed to support children and families in Part B of the Katie Beckett program. In Part B, we have the HRA as one of the offerings, the healthcare reimbursement account that has become overwhelmingly the most popular service in the Katie Beckett Part B program. And because of the success of that benefit and the flexibility offered by that benefit, we really thought that we could apply this approach to provide support to children in foster care with IDD and really help support these families both financially, emotionally, and physically as well. As I mentioned, it's called a healthcare reimbursement account model, and it does provide that flexibility. It's really, it really provides funding to really meet that child and family's individualized needs, and really stretch that funding to cover those most urgent needs and really provide a lot of support for families. So a little bit more about the HRA, the healthcare reimbursement account. There are many in DIDD that also already know a lot about this account, but for our friends at DCS, I'm going to go over just a quick overview. Healthcare reimbursement account, we call it an HRA. This is very similar to a flexible spending account or a health savings account in an employer-sponsored plan, where families either have a card to pay for qualified expenses, or they can pay for those expenses and then be reimbursed after the fact. As I mentioned, it's similar to an FSA or a HSA that many people use through their employer-sponsored plans. A difference between the HRA and the Tennessee Strong Families HRA versus the Katie Beckett HRA is that the Tennessee Strong Families provides up to $20,000 annually in HRA expenditures, where Part B is capped at $10,000 annually. DIDD does contract out this service, and we use a company called PayFlex to operate that HRA service. Since we're all state employees here, many of you might remember that PayFlex was our savings account, HRA, dependent care account that the contractor we used for our own employer sponsored health plan a few years ago. So PayFlex is being used by DIDD to operate the service. And the HRA, it has a lot of flexibility, but there is something that is needed. The IRS, the Internal Revenue Services, actually issues guidance on what types of expenditures can be used through what type of expenditures can be reimbursed or paid for through these types of accounts. And we do use that IRS guidance to operate this program. We do have a card. PayFlex issues all families a card that can be used at many medical establishments to pay for those expenses upfront. So you go somewhere to a doctor's appointment, they take the PayFlex card, you can just swipe that card and pay for your copay, and that doesn't come out of pocket. Now, if an establishment does not accept the PayFlex card, families can pay upfront and then submit documentation for reimbursement after the fact. There are some qualifiers here. Documentation is required to be submitted for all expenditures. So even if you're using the card, we still need to know what you paid for, so that we know that it is possibly medically necessity if a letter of medical necessity is required, and is one of those IRS reimbursable expenses. There is also a daily card spending limit. If you are using that card, the maximum you can spend on the card per day is $2,650. So that is for the card. There is no daily reimbursement limit though. So if you pay for something and then get reimbursed after the fact, that limit does not apply. That $20,000 maximum, that has to be spent in a calendar year. So January 1st is the beginning of the calendar year, and it does go until December 31st. So that $20,000 starts again every January 1st, and you have until the end of the year to use it. This does not roll over. This benefit does not roll over from year to year, meaning that if you do not spend all of the $20,000 in one year, you do not get that additional funding you didn't spend in the next year. It's $20,000 for year one, $20,000 for year two with no rollover benefit. So there's a lot more about the healthcare reimbursement account, and DIDD has a lot of information about how to use that benefit and submit a claim, along with the eligible and ineligible items in its HRA guide for the Tennessee Strong Families. We do have a link there for it in this presentation. Of course, we'll provide this presentation after the fact as well. I'm not going to show this video, but I do, if you're looking at this presentation later, want to include a link to this video. This is a young man, Grayson, who lives in the Chattanooga area, who has been on the Katie Beckett program. And his family was really able to use the funding through the Katie Beckett program in a variety of different ways to really help him help his mother at doctor's appointments by being able to purchase developmental toys to help keep him occupied during those appointments so she could make those trips with him by herself and not need someone else. And also when he aged out of TEIS, a lot of the funding they were able to use some of the funding to continue some of those successful programs and therapies that he was getting through TEIS after that, and be able to pay through the HRA for those funds. It's a great video, and I highly encourage everyone on here to watch it. The link is in the presentation as well. So let's get a little bit more into the details about Tennessee Strong Families, because it does work. In essence, it works the same as the Katie Beckett Part B program, but there are some key differences because this is a different population we are working with. So let's first talk about eligibility. All referrals for the HRA program in Tennessee Strong Families, it's going to come from the DCS case managers. We do not take external applications for the Tennessee Strong Families HRA. We are getting these referrals straight from DCS, and it's those case managers who have been charged with identifying and providing referrals to DIDD of children who are qualified to receive the HRA benefit. So that is one key difference when it comes to how this program is operating. There's no external application process, and everything is done through the referrals from DCS. Something that's similar is that all children who are enrolled in the Tennessee Strong Families HRA, they must have a diagnosis of an intellectual or developmental disability. So this program is only for children with IDD, and that is something that we'll be looking at as we're looking to determine eligibility. So a little bit about DCS caseworker responsibilities, then I'm going to turn it over to Bo to talk a little bit about some of the documentation we look for when looking to find eligibility information. First of all, DCS caseworkers, we're expecting them to identify children in foster families who are eligible for the HRA benefit. Then what they do is they identify those children and they send that referral information to DIDD. That includes demographic information for the child and foster parent, and also a DCS caseworker contact for each child. We do ask for documentation supporting the IDD diagnosis. If it is available up front, we would like that immediately, or we may need to request additional clinical and medical assessments within 30 days. Then, and we'll talk a little bit more about the ISC role in just a second, but once that child has been referred to an ISC to work on enrollment and collecting the documentation to determine eligibility, that DCS caseworker will work with the ISC to collect that additional documentation or assessments when necessary. Then once that child's enrolled in the program, we do ask that they interface with the ISC at least quarterly or more if needed, to make sure that our service goals in the HRA are aligned with that child's and family's long-term goals, and also review the status of services and supports paid for through the HRA account. And then we do need the DCS caseworker to notify the ISC when there is a disruption in the foster placement, so that HRA benefits can be terminated or transferred to a new foster family. That is a reality of children in custody, is that they don't always stay in the same place. While we're hoping this will create more stable placements, there will be these disruptions, and we want to make sure that that benefit is following that child from one foster placement to the next foster placement as well, and that we're able to terminate it with the foster family who no longer has custody of that child. Bo, do you want to talk a little bit about some of the documentation, things that we're looking for, things that we've seen already, or any things that you would just want folks to know as we've really started to work through this?
Yeah, thanks, Kara. So yeah, as Kara mentioned, we're looking for a diagnosis of intellectual or developmental disability across the board. I will tell you guys, we got 400 referrals from DCS to start the program a little bit before 7/1. We are processing those referrals right now. And so what we used on those were the diagnostic codes and diagnostic listings for the child's medical encounters. We were able to get those through DCS from Blue Care. Obviously, we know that every child in DCS custody has Blue Care, TennCare Select as their MCO. And so we were fortunate enough to be able to obtain those diagnostic listings for children. So we really have a heads up on kids who qualify. We're going on diagnosis alone in most cases. If we see a diagnosis that we're not sure about, then the ISC is probably going to reach out to the DCS case manager, you, if you're on here, and ask you for some assessment information or further clarification to make sure that we're supporting people who have intellectual and developmental disability. Certainly need to point out this program is for children with intellectual and developmental disabilities and not standalone mental health diagnoses. And those are oftentimes different, so we don't want to confuse those. However, the listings that we're getting from Blue Care are pretty clear. We've really been able to substantiate most kids with having the correct diagnosis. That was the first batch that came to us from DCS. In the future, we're going to get one-off referrals from you guys, or however you guys do that internally will come to us. You can provide the documentation of an assessment that shows ID or DD, or we can also use, again, the diagnosis from Blue Care. Either one will work. The IC will be verifying that. If there's questions, they'll reach out to you as the individual case manager to clarify anything. So that's that's the way it's going. It seems to be going well so far. We're working on it, getting some additional information from you guys for contact information, in some cases for foster parents, but that's really in a nutshell, and it seems to be going well. Thanks, Kara.
Thank you so much, Bo. And like I said, we do have some real, with this being active now for more than a week, or just about a week, we do now have some real work that's already happened with this implementation, and so we're able to see things and address them and triage them, and then also understand how things are moving through the system. So we're very excited about that, and it's been great so far. So we're very thankful for all of the hard work that our partners have put in on making this a reality. Okay, so now we're going to talk about case management for the Tennessee Strong Families program. So many of our DIDD folks are very familiar with the role of the Independent Support Coordinator in DIDD's waiver services. And DIDD is using its contracted independent support coordinators to provide case management specific to the Tennessee Strong Families HRA program. The ISCs, they are currently providing that coordination in our DIDD home and community-based waiver programs to adults with intellectual and developmental disabilities. For our DCS partners who are listening, these ISCs have years and years of experience providing and developing support plans to help people with intellectual and developmental disabilities live the lives they envision for themselves. They are their advocates. They help work with the providers, and they help work for families. They do provide a really key role in our service and support system. And another thing that they do is they connect people to those service and support providers as well. So really one thing that we expect them to do is really help provide that case management for folks. We'll get a little bit more into their responsibilities on the next slide, but we're going to go a little bit now into how they receive these referrals. We already talked about how DCS sends over the referral data. So DIDD is maintaining a SharePoint site for referrals, and it is accessible to independent support coordinators who provide case management for the Tennessee Strong Families HRA program. So the ISC agencies check SharePoint daily, and they identify any referrals in the county they serve, and they reach out to the DCS caseworker within 2 business days to request documentation of IDD if not already provided. So that's how things start. The information comes to us, it gets assigned out to the ISCs, and then the ISCs make contact with the caseworker to get the additional eligibility verification process started and get started on that enrollment process. Bo, would you like to add anything about how this has gone so far?
I think this is going pretty well right now. I mean, we have ICHs who have access to SharePoint. They go in there each day, they pull the referrals, and that's why you may be receiving contact from them, because we're going on the information provided from DCS to be able to reach out to you as a DCS case manager or caseworker to be able to resolve any outstanding information needs. So it's going pretty well. Yep.
Excellent. So now we'll talk a little bit about the ISC responsibilities. First and foremost, and we've talked a little about this already, they are responsible for the intake and enrollment into the HRA program. So that information comes directly into the SharePoint, it goes to the ISCs, and then they're conducting the intake and enrollment into the program. Then they meet with the family to develop the support plan and set up the HRA services with PayFlex. So they'll work with the family to help educate them about the specifics of the HRA and work on setting up those services. Collecting the signatures that they need on the required forms, and really getting them enrolled into PayFlex and help them learn how to use the PayFlex benefit. They'll continue to contact the family monthly by phone or other method as requested by the foster parents. So we do expect monthly contact. It is up to the family to decide if they would like to have that to be a different type of contact, whether it's an in-person visit or a Zoom meeting. We do ask that our ISCs are meeting the needs of the family. And if that family has a different way they like to be contacted, we're asking them to help meet them where they are. But we do expect that they will meet face-to-face every 6 months with that foster family at least, or as I mentioned, at any time upon foster family request. Then we want them to make contact with the DCS caseworker at least quarterly. So we can make sure that what we're doing in the HRA is continued to be aligned with what those long-term goals are for that child and that family. We would like the HRA service to be perfect, but there are always going to be some things that come up that could be bumps in the road, questions about claims, and the ISC will work with the family to resolve any of those issues when it comes to HRA claims. And then another thing, and something we've seen in our Katie Beckett program, is our case managers have been a wealth of information about ideas that the money can be used for. So we expect that our ISCs will continue to identify any of those needed services and supports that help that child's health and well-being, and come up with some of those ideas and the innovative ways that families might be able to use that money to best support their child. As I mentioned earlier, in this world, there are disruptions and transitions. Important to note that the HRA benefit does follow the child. So if there is a permanent disruption in the foster placement, the ISC will work with the foster family to identify first any unpaid reimbursements. So if before that disruption happened, there are still expenses that could be reimbursed. The IC will work with the foster family and also work with PayFlex to get those claims submitted. The foster family will have 90 days after that disruption to submit outstanding claims. So there will be a time limit for how much longer they can submit those outstanding claims. And if the child is placed with a new foster family, the ISC will work with that family to set up the HRA account. So to make sure that that account is set up. As we mentioned before, the funding does get renewed at the start of the calendar year. So it does follow the child. So $20,000 from January 1 to December 31. It will renew at the start of the next calendar year. Another thing that happens in the DCS world that is not something that is common in our Katie Beckett program is adoptions. So we're all hoping that families that if reunification is always the first goal, but if that's not possible, many families might proceed to adoption with their foster child. And children in the Strong Families HRA will have 1 year of continued HRA eligibility after adoption. So after that adoption happens, they will continue to have 1 year of eligibility, and that means that their ISC will stay in place and will continue to work with the family, and also not only work with them on that year the same way they are to use those benefits, but also help connect that family to other programs that they may be eligible for after that Tennessee Strong Families eligibility ends. So overall, as we mentioned, the goals of the HRA include removing barriers to find stable foster placements and incentivize adoption for children with disabilities across Tennessee. We really want to make sure that we're not that some of the challenges that some children sometimes provide, both financially or in different ways, are alleviated through this program, and also help to offset the unexpected costs that families may experience when they're fostering a child that has disabilities, and of course, providing that financial, emotional, and physical relief. So we have a lot of resources, and we've prepared a lot of resources to assist caseworkers, ISCs, and foster families. So those are all available on our website, which I am going to pull up in just a second. And then also DIDD and PayFlex did hold a webinar about the Tennessee Strong Families HRA and how to submit claims through the PayFlex portal or app. And there's a link to that recording there. And that is really more of the details of PayFlex, like how do you do it on the PayFlex portal? And it is with our partners at PayFlex. So that really gets into a lot of the details about the actual day-to-day use of your HRA benefit. So with that, I'm done. With that, we do have a lot of questions, and I'm going to get to them in just a second. I do want to first pull up the Tennessee Strong Families HRA. And what I'm going to do is I'm actually going to start so I can show you how to navigate to it from our website. So let me share. Okay. So here's our website. Here's our main page. If you go to the Community Services tabs, you go all the way to the bottom, Tennessee Strong Families HRA. Here it is. So you can see that we have the healthcare reimbursement account guide. We have it in a text format on our web. We also have a printable version here. So if some people just like to have it all in front of them where they can flip the pages, we do have that available to you as well. We have a couple of different links in here, and I'm going to scroll down because there's a lot of information in here. We have a one-pager on the Tennessee Strong Families program, the HRA program. We have previous presentations on there. We do have a flow chart about how the Tennessee Strong Families HRA works alongside DCS case management. And then we have a version of this presentation that we're giving you right now on here as well. That was that we gave to ISCs a little while ago. Another thing, you'll see there's a lot of information about how to use the HRA. We also have the Appendix A of the IRS eligible and ineligible items. It is broken up into eligible items where we need a letter of medical necessity to be able to approve, and then ineligible items. I do want to put a disclaimer on this really quickly, in that this is the complete IRS list. So you might look at certain things and be like, why would a child ever use that? This is not a list that I felt like that we needed to really mess with. This is the official HRA list, so we do have it in its entirety. So just so you know, when you're looking at it, and you might be wondering why some of these things are on here, it is because this is the complete list that is for all reimbursable expenses. One other thing, the short link for this, if it's easier for you to find it directly, is www.tn.gov/DIDD/TSF. So that is that short link, and that you can get to that. And I'll have somebody drop that into the chat if it's not already there. So I am going to go up. And if we don't have answers to the questions, then we will we'll come back to you. Let's see. sorry, I'm seeing with Teams, you have to go through everybody who joined the chat before you can actually find the actual questions. Can you give an example of medical services that may be needed for a child that would not be covered by TennCare? Bo, would you have an example of that?
Yeah, it could be absolutely a host of things that aren't covered by TennCare. When we say medical services, it's not the traditional medical services you might be thinking of. It could be things like it may be actually be like something like behavioral support services, but it may be a provider that's outside of the TennCare network. It may be somebody that you prefer, but they're not in network. They can use this funding to pay that behavior analyst, or they could use this to build, some kind of fencing or some kind of adaptive equipment that's not covered through TennCare. There's just a whole host of things that can be covered. Non-formulary medications can be covered with this. There's just a lot of things that can be covered outside of the TennCare benefit.
One thing that people do use this for in the Katie Beckett program quite often is it can be used for respite. So if you need to pay somebody to provide that respite. Another thing that it can be used for is sometimes we'll have families who are dual enrolled in TEIS in the Katie Beckett Part B program, and the provider that they started in TEIS with has left the TEIS provider network, but they want to continue on with that provider. They can use these funds to private pay for that provider if they feel like that provider is making a difference in their life. Also, those developmental toys that the Grayson in the video, those are not something that would be traditionally covered by insurance, but they were able to use the Katie Beckett funds to be able to provide that. There are a whole list of things. We could come up with a million examples of where we've been able to do that, but it really has a lot of flexibility and a lot of applications outside of quote unquote traditional medical benefits that have really, honestly, it's what has set it apart from every other program we have, is that it has been able to be used for a lot of things that you just don't think of. I actually found out that we have some acquaintances that were able to use, are in Part B, that their daughter has muscular dystrophy, and they were able to use it to help install an elevator in their house because she has lost the ability to use to ambulate independently because of the progressive nature of that disease. How will you get notified? What if a child is in state custody, but it is placed in another state? Are they still eligible?
Yeah, so there's some nuances to this question. Honestly, if the child is placed out of state into a residential facility, in other words, not in a foster care home, then they're not going to be eligible. If they're in a foster care home in another state, which I guess is possible, then we can look at that case. I don't know of a prohibition on that, frankly, and it seems like it would be something we could consider and do. Again, but it's not going to be for kids who are in any kind of residential treatment facility, in other kind of facility other than in a foster home. That said, since I brought that up, since we're talking about who's eligible and who's not, I don't know if we mentioned this, and Carrie, I may have missed this in the presentation, but if a child is adopted in this program, then we're going to extend the benefit for 1 year from the time of adoption, up to 1 year post-adoption to the new family. So just wanted to say that in case that wasn't brought up.
Excellent. Thank you very much. How will you get notified that the child has disrupted a home?
So we're going to depend on DCS to do that. We're going to depend on ongoing contacts and being involved with the DCS case manager or the FSW or whoever else is involved in the CFTM. We need to know about those things. And so that's how the maintenance of contact with DCS will be the primary vehicle that we learn about any disruptions, and our contacts with the foster family every month. We're going to be contacting, the IACs will be contacting a foster family every month minimally. And so we should have good ways to know when a child's disrupted.
Okay, the next question is, it seems to be another out-of-state question similar to the other. I think we've covered that. Which non-traditional, when compared with SLP, OT, and PT therapies, are reimbursable? On that one, I think it's really the sky's the limit. So I'll turn that over to you.
No, I think to your point, I think we're thinking the same thing. I think really there could be a host of different types of therapies that are outside of what we consider traditional therapies that could be covered under this benefit, similar to what we were talking about earlier, whether it's respite or whether it's some kind of different therapy that's not covered under a formulary by TennCare. It could be anything, just about. Some of the things we talk about here, we haven't talked about. Some of these things will require a letter of medical necessity that's signed off by a treating clinician. Those types of things are very important because when we have a letter of medical necessity, you can get some things paid for that you traditionally may not be able to get paid for. So there's lots of nuances with the HRA benefit. Our IAC agencies are going to learn about that. They're learning now, and once they learn, they're going to be able to help families tremendously in terms of accessing things that they're not even aware they can access. The IACs will also really be able to help families identify things outside of what they think they are eligible for that's going to benefit the children, and we hope will continue permanency.
Excellent. Thanks, Bo. We got two people, the basis of the question, and there are two people who have children who are enrolled in the Katie Beckett program, and talk about the blessing, but also talk about the documentation needs of the HRA. As I said, that there can sometimes be bumps in the road there. The question is there anything in the works to make that process easier to for families to keep up with? When it comes to documentation submission, letter of medical necessities, some of the same things that we've worked on in the Katie Beckett program, really revising that letter of medical necessity to make it easier and more help make it easier to, I guess, get right the first time, as opposed to having the level of detail, shall we say, that PayFlex likes to see. We worked with them to understand where were some issues happening. We have revised that as of July 1 and distributed that in the Katie Beckett program, but also that's the one we're using for the Tennessee Strong Families program as well. And then continuing to try to make those areas where we can refine to make sure that we're making sure that PayFlex has all of the information they need to see and understanding what they need to see, and so that we can help alleviate some of those denied claims the first time. Bo, do you have anything else you want to add on that?
Yes. I would also say the IAC's role is going to be to help families resolve those issues. We have ongoing conversations with PayFlex regularly. There is a escalation mailbox, so there's some things that are going to take time. Sometimes the claims aren't submitted correctly. Sometimes there's missing items. Sometimes it's PayFlex not understanding what the claim is really for. So there's always going to be some challenges, but I feel like we can do a better job of helping families, foster families, resolve any issues they come up with or any issues that occur.
How does this program interact with the ECF Choices program?
So this program doesn't interact with the ECF Choices program because kids who are in custody are not enrolled in ECF. So there's really not any connection between this program and ECF.
What if the child is in state's custody and placed in a non-paid kinship home out of state? Would they qualify?
Is that considered, I would have to ask the question, is that considered foster care? And if it is, then we can talk about that particular case. We might be able to look at that referral. But again, it really comes down to, is the child in foster care?
Okay. So for youth with IDD who have turned 18 and are in extension of foster care and awaiting a long-term transition to ECF Choices, would they be eligible for, this seems to be a tier 1 question, one of these homes while awaiting their ECF transition? Usually we are awaiting their adult SSI approval for the 6 to 12 months post-custody. This seems to be a question specific to the Tennessee Strong Family Homes, and I'm not aware of what we're looking. I believe we get all of those referrals from DCS as well. Okay, sometimes a child in foster care is placed with an approved foster family, often relatives, via an interstate compact, ICPC. And Jordan did say correct to the question about the waiting for ECF. We do currently receive all of those referrals for our Tennessee Strong Families homes from DCS. So that's where we have found those children to place in these homes. So yes, they are still in foster care when it comes to the question about the kinship. So I think that's definitely a situation that, as Bo mentioned, we would want to have a conversation about and look into. Okay. Do we have any other questions in amongst our guests? Okay, Bo, do you have anything else you want to add before we wrap up this?
The only thing I would say is that we're really excited to be able to offer this program and delve into this program and be able to offer real supports to families and kids in foster care. I mean, we know it's a huge challenge to maintain foster care placements. We really think this program is going to be so beneficial for families in terms of permanency and really to impact the health of the child and the family unit itself. So we really look forward to working with DCS on this moving forward. And only know things will get better. So yeah, thanks, Kara.
All right, and thank you all for joining us today and taking some time out. This really helped. This really helps us to be able to spread the word about this program, make sure everyone knows about it, and also answer questions because, you know, especially with having some of our folks from DCS on here, we learn things as well. So hope to be able to offer more of these opportunities, and we're just excited to work with everyone and look forward to sharing more information with you and partnering with everyone together. Thank you.